Hey, this is Attorney Walter Hnot with Disability Resolution PA. You guys know me as the most viewed, subscribed to, and clicked on disability attorney in America. And one of the big things I want to do is just reach out to you and talk about something really cool that we're going to be doing in the future, which is that we're going to be talking about Medicare. Now, as you know, we never really go into Medicare because it's just not my jam. It's not my thing. And so with that said, I like to talk about politics, adjudicators, case law, what's transitioning, all that stuff. But Medicare has never been my thing. So I reached out and was able to snooker an attorney to go ahead and come on the show that specifically does a lot, and I mean a lot with Medicare. I recently saw a video where he was in front of Congress doing his thing. It was just awesome. One of the things I want to go into is what Medicare is, what you need to watch out for, how it works. Now, he works for this company called Chapter, and Chapter does a lot of cool stuff where basically they'll go ahead and find a really good fit plan for you, whatever that means for you, because everybody's different. Everybody's got different impairments, different medications, different operations, different whatever that they need. They'll be able to go ahead and do that. Remember, with Medicare, it's not like Social Security disability benefits where you're constantly checking in with the SSA to be like, do I have the best fit? Do I have the best plan? SSDI in that. Medicare is that. Every 6 months, 12 months, you should be checking in with a group. In this case, I think you should check in with Chapter. But anyways, you should be checking in with a group that basically will allow you to go ahead and find and make sure you've got the best plan, the best option going on, because they change that stuff. Now, here's the thing. I'm going to put some contact details below for Chapter. That way you can go ahead and give them a call. You got two options. You got the first one is the phone number, which is the 339-226 and the 6287. You can call that. They'll go ahead and work with you, make sure your plan's good. You also have askchapter.org/disability. Right? They set up their own little thing just for me so you can go ahead and call them and do that stuff. Now, a couple of basic things about Chapter, because I know everybody's like, what's this new company? How does this work? Yada, yada, yada. Here's some basic stuff. Just some notes here. So I started to look into Medicare, and I noticed that there were some cases, DOJ filed, basic things, where there was specific abuse against disabled individuals. It's my place. It's my zone. That's my hotspot. Where they were selling, not Chapter, but other Medicare groups, they were selling these plans, right? That basically, pushing the plans, go in that direction, where basically they were for the most benefit of the person pushing it, like the highest percentage that they could potentially get. That's not Chapter. Chapter's doing a thing where basically all their people are salaried, all their people are in a good spot where they are basically saying, okay, this is the best program because it offers this for you. It is not about what the percentage that they're actually going to get for you. They are a big group, which is, in Medicare land, you have to have that to have like a really effective thing because they got to be able to review all the different policies throughout the entire nation. So just some basic things to kind of keep in mind, like, I like what this group is doing. I like it so much that I reached out, and I'm going to borrow their attorney to use for videos. So I just want to go ahead and take a moment. Attorney Walter Hnot, I'm going to have him introduce himself. Good sir, would you be so kind as to tell us who you are and what you do for Chapter, and then allow me to ask you some cool questions.
Hi, Walter. Thank you so much for having me on. My name is Ari Parker. I'm a co-founder and the head of Medicare Advisory here at Chapter. The most important thing that I do each day is to make Medicare simple, and that's why I wanted to be on your channel to help your viewers and to answer their thorny questions about how to get Medicare in conjunction with their SSDI benefits. My role at Chapter is training and overseeing our team of Medicare advisors, and I hope your audience will give us a shot after watching our interview. We'll help anyone watching this video understand, choose, and use your Medicare benefits to make sure that you get the most out of your health insurance coverage. Now, there's no charge for our services, and we're nationwide, so wherever you're watching this video, we can help you with your Medicare, regardless of whether you have SSDI or not.
So that's amazing. So one of the big things I want to ask you about is this whole comprehensive coverage thing. And in your book, and I've got it here, I've actually been going through it just to, let you know all the little details. And hold on, let me get it. I'm on the first page. Sorry. Actually, no, I'm not even there yet. I've been going through it. I've been making notes. I've been trying to I like it. And you got this cool thing about pizza right in the front. Me loves the pizza. But let me ask you this. You talk about comprehensive insurance and how you want to shoot for having the most comprehensive plan you can, and that there's this 20% gap situation. Can you walk me through what is comprehensive insurance realistically for the average person? what is the gap, the 20% gap? How do they get to the best spot so that they have to pay the least amount for the most stuff that they're going to need?
All right, let's talk what it means to have comprehensive Medicare health insurance. You can picture Medicare as a three-legged stool. There are three parts to Medicare. The first leg of the stool is your hospital insurance, what happens when you're inpatient. The second leg of the stool is your outpatient coverage, that is everything outside the hospital, including outpatient surgery, durable medical equipment, and even vaccines. The third leg of the stool is your prescription drug coverage. Now, each of these legs correspond to a part. Your inpatient coverage, that's Medicare Part A. Your outpatient coverage, that's Medicare Part B. And finally, your drug coverage is Medicare Part D. What your viewers might be surprised to learn is that original Medicare just refers to the first two legs of the stool, Part A and Part B, and it's not comprehensive health insurance. If your viewers only have Medicare Part A and Part B, then they still owe 20% for their medical costs out of pocket, and there's no ceiling on that 20%. So take my mom. She lives in the Chicagoland area and she's on Medicare. Last summer, she needed a knee replacement, which is a $50,000 procedure in the Chicagoland area. So had my mom not had some type of additional coverage, she would have owed $10,000 for her knee, and the very following month, she broke her elbow, so her out-of-pocket costs would have been well over $10K for last year, even though she had Medicare. And that's exactly what our team at Chapter is here to help your viewers with. We help you get insurance for that 20%. And the good news is that there's only two options in order to cover this, and that's what we're going to talk about as part of the video. Option one is to choose a Medicare supplement plan, which sits on top of original Medicare, and to add a standalone prescription drug plan. So that's option one. Option two is Medicare Advantage, which is an all-in-one option provided by a private insurance company that covers your viewers' hospital and medical costs. And many of these plans also include prescription drug benefits and additional benefits bundled in, like dental, vision, and hearing.
Okay, so what you're saying is there's this Advantage plan, and the Advantage plan has all these benefits, options, articulations, and you guys help them get that Advantage plan. So like walk me through here, like before they call you, before they're like boop 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 boop, what needs to be in their bullet point, like the boop 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 boop, and what do they need to be thinking about when they call in? Like what are the, like, you know, what are some of the questions that they need to have answered in their brain so that when you guys are like, hey, have you considered this Advantage plan, they can be like, this is what I need to know, this is what I need to tell you. Like what do they need to get across to you and your folks so that they can get the best deal? Because there's some bias against people under 65 and it is not good. So what do they do?
All right, so you're asking about Medigap, which is also known as Medicare Supplement. This is the most comprehensive policy someone can purchase, but here's the catch. If you're on Medicare, but under age 65, which many of your viewers watching this video are, then your ability to purchase a Medigap policy depends on the state that you live in. Some states allow anyone with Medicare under 65 to buy a Medigap policy, but if you have end-stage renal disease or a disability, you may not be able to purchase a Medigap policy, or any Medigap policy for that matter, until you turn 65. So in short, federal law doesn't require insurance companies to sell Medigap policies to people under age 65. And if you're curious whether you live in a state that would enable you to purchase a Medigap policy, give us a call and we'll help you figure it out, because we know each state's rules inside and out. But here's the good news. When your viewers turn 65, this is their golden opportunity to purchase a Medigap policy without any questions about their health history, and they won't have to pay a higher premium than someone with standard health. That is, a carrier can't deny you, and they can't charge you a higher premium if you're in your Medigap open enrollment period, which coincides with when your viewers turn 65. So if they're younger than 65 and on Medicare, then it might be to their benefit to consider a Medicare Advantage plan until they turn 65.
That's amazing. That's really good. So I want to ask you kind of a question that might be a little spicy, if you will. And I mean, like, if it's too spicy, you don't have to answer it. But here's the thing. I've noticed with my SSDI claimants that they get the crappy end of the stick when it comes to Medicare. And I've noticed that usually there will be like, they're charging extra premiums, double premium, triple premium, or they won't let them get into basically like a Medigap, function option, coverage thing. You know what I mean? They're just stuck and they can't get the good stuff. And I don't know what the deal is because, when people need, medical insurance and they're found disabled on SSDI Title II benefits, you would think the government would be digging, making sure that they're taken care of, as opposed to, it seems like, I'm not throwing any fingers or knives here, but it seems like if they're under 65, my peeps getting found disabled, Gov does not show them the love. What's the deal with that?
When your viewers call our team, it's helpful that they have a list of their 3 Ps handy. And this is what I write about in my short book on Medicare. It's not that complicated. Here are the 3 Ps. First, your providers. Please have a list of your doctors ready when you call our team. We want to make sure that each of your doctors or institutions or hospitals are in network for the coverage that you're choosing. It's very important. We want to make sure you have established relationships with your providers. We want to make sure that you're able to continue to see them. The second P is a list of your prescriptions. What medications do you take? Whether it's a brand name or generic matters in terms of calculating the cost. The pharmacy that you like to go to matters as well. We want to make sure that you can continue to go to the drugstore that you've been picking up your medications at, whether it's a national chain or a mom and pop drugstore down the block from you. And then the third P is a list of your priorities. What's important to you? Is it most important to have the most flexible and comprehensive coverage and you're willing to pay top dollar for it? Or are you optimizing for your bottom line? These priorities vary individual by individual, and that's why we have a personalized conversation and then build a short list of options for you to consider, searching every plan nationwide. And this varies county by county across the United States. There are hundreds of insurance companies offering thousands of plans, and we have all your options at the touch of our fingertips.
Okay, so another quick question. I know I'm kind of like sliding them in real quick here, left and right. But the bottom line is this. Let's say somebody is found disabled. Classic thing, right? They get found disabled, and usually within 2 to 4 weeks, they get this like envelope with all the stuff. So just to go through the basics, right? So somebody's found disabled, let's say an adjudicator, OHO, ALJ, administrative law judge, takes out the magical Harry Potter stick and says, poof, you're disabled, right? Cool. Then it goes back to the local field office. Local field office looks at it, says, okay, they're going to be found disabled. Very good, right? And then they have to do the pre-effectuation call, right? So they ring the claimant. Claimant goes, okay, here's where you can send the money. Here's the answer to that question, blah, blah, blah. Then around 2 weeks after that, maybe a little less, maybe a little bit more, sometimes 4 weeks, then they get this package of Medicare stuff. What do they need to know at that point? Like, what should be flowing through their brain? What happened? I mean, because look, let's just be fair. When they get the package, it's okay. Let's just be realistic. Not all of my claimants that are found disabled are going to read that thing. What do they need to know? How do they get the best answers? How do they go ahead and approach this thing so that they end up with the right, whatever it's going to be for them, the right program up front?
When your viewers receive their red, white, and blue Medicare card, they should give us a call because that red, white, and blue Medicare card only covers 80% of your viewers' medical expenses. We will help them get insurance with the other 20%. And remember, there's 2 options to consider here. Option 1 is a Medicare supplement plan. And in this case, your viewers would want to be sure to add a standalone prescription drug plan, so that way they have their medications covered as well. The second option is a Medicare Advantage prescription drug plan. This is an all-in-one option administered by a private insurance company. And if your viewers go with option 2, which is Medicare Advantage, then we just want to make sure that the plan has all of their providers in network, that it covers their prescriptions affordably, and finally, that it meets their priorities, that it's going to be the plan that works best for your viewers, wherever they might be, because these plans vary county by county across the United States. Then, our support is ongoing. It's not a one and done relationship. We're going to help you get the most out of your Medicare. Our member advocate team is your first line of defense for any questions that come up about your coverage. You don't have to call the insurance company. You call the chapter member advocate team, and we'll help you get to the bottom of any issues that you have with your coverage.
Okay, so explain to me this. Here's the thing. Like, they're starting off. They're ramping up to get their health insurance, right? They're getting their check. They're feeling good. They're gonna, they get some new clothes. Go buy some fruit at the grocery store. They're gonna make it feel good. So, what happened? Now, I've heard about this. There's like a cliff. You know what I mean? There's like a Medicaid, Medicare, you're stuck in a zone cliff situation where, like, let's say it's $50 too, high to qualify for your Medicaid option, and then basically, but you're still not enough to be able to, like, you don't have it to pay for the Medicare, where basically, you can't afford, the out-of-pockets, you can't afford the premiums, you can't afford, just the time to figure out how to. What happens with that? Because, I'll get calls about Medicare, and I'm just like, I'm just not my thing. You know what I mean? So, like, how do they not get stuck in that weird little cliffy spot?
Now we're getting into how Medicare coordinates benefits with Medicaid. And yes, you can actually be eligible for both. And if you are, there are plans that coordinate benefits between Medicare and Medicaid. And it's something that the chapter team is expert on. So in a Medicaid spend down, a person qualifies for Medicaid if they spend down the difference between their income and their state's Medicaid income limit. And you just need to spend down the limit on healthcare expenses. Once you reach the limit, you qualify for Medicaid. As an example, imagine you're on Medicaid and your state's Medicaid income limit is $2,000 a month. So you have Medicare and your state has a Medicaid income limit of $2,000. If your monthly income is $2,200, you just need to spend down the $200 difference. And once you do, then Medicaid would cover the remainder. So if you spent $250 per month, Medicaid would cover that extra $50. Now, spend down programs go by different names depending on where you live. In some states, it's known as an excess income program, a surplus income program, or a medically needy program. And each state may have a different spend down period. So this means you may need to spend down anywhere from 1 to 6 months difference between your income and the Medicaid income limit in order to qualify. How do you know if you qualify for a Medicaid spend down? You may qualify for Medicaid with a spend down if you have high medical expenses. Also, people who have income or assets over the limit for Medicaid, for long-term care, for example, will also need to spend down the difference in order to qualify for Medicaid. Now, these programs can have some extra restrictions. I'm happy to do another video on what those restrictions might be. But in order to apply for a spend down program, go to your state Medicaid office. They will tell you if your income is too high for Medicaid, and then you can ask them if there's a spend down option available, and they may have a separate application process in order to apply for that spend down option. Or you can call the chapter team and we can point you in the right direction. Finally, I want to mention, here are some examples of healthcare related expenses that you can use to spend down your income in order to qualify for Medicaid. These include paying for medications, paying for medical bills, paying for your Medicare Part B premium, which is $185 per month in 2025. You can also qualify for the spend down program if you have nursing home care expenses, or even if you need health-related home renovations, such as a wheelchair ramp or a chairlift. And then, of course, transportation to medical appointments also might count towards your state's spend down threshold as well. Make sure you keep copies of medical bills and receipts for any of your healthcare-related purchases to show your state Medicaid office proof of what counted toward your spend down period. Your viewers might be wondering what happens if they don't spend down enough of their income during their spend down period. And if you can't spend down enough income during your spend down period, you might temporarily lose your Medicaid coverage, but your Medicare benefits would continue. So it wouldn't affect your Medicare benefits. You might just lose Medicaid for a temporary period in which you don't have enough spend down. This is something a Medicaid caseworker can answer questions or concerns about, and there's no harm in applying for Medicaid. The worst thing that happens is you get rejected. So if you think that you might have a low enough income in order to qualify for Medicaid, it's certainly worth applying for. And this is something we'd be more than happy to help your viewers with as well.
Okay, okay, now I get that, but what, all right, so let's say, now that's like, and we're probably talking about a particular age group of people, but what if we had a younger claimant? Because I'm one of the few law firms out there that still works with claimants that are younger. They're tougher claims, you get weird decisions from judges, you can't grid them out, in the 50 to 55, 55 to 60, 60 plus. It's just tougher to win those claims. So I'm one of the few firms that still works with people who haven't been working that long. And here's the thing, I know that with like, basically you've got like a premium part A, technically it's supposed to be free if you work for 10 years. But what happens if they didn't hit that 10, what if they didn't get their 40 quarters of coverage? Like if you just pin it down, they didn't get it, they don't have their 40 QCs. What if they're just too young to actually achieve that? Like what do they do? They have to buy like something. How does that work?
All right. What's the cost for Medicare Part A? So people who meet all the criteria for Social Security disability are generally automatically enrolled in Medicare Parts A and Part B. People who meet the standards but don't qualify for Social Security benefits can purchase Medicare by paying a monthly Part A premium in addition to the monthly Part B premium. The cost for Part A is $0 for most people because they've paid their Medicare payroll taxes for 10 years or more. And even if you haven't paid in for 10 years, if your spouse has, that works too. So if your spouse has worked for 10 years plus, then you're entitled to premium-free Medicare Part A. But what about someone who's paid federal payroll taxes for less than 10 years? If you don't qualify for a premium-free Part A, then you can actually buy it from the government. In 2025, that premium is either $285 or $518 per month, depending on how long you or your spouse worked and paid Medicare payroll taxes for. So if you worked for less than 7.5 years, or your spouse worked for less than 7.5 years, it will cost $518 per month to purchase Medicare Part A. And if you worked for 7.5 years, but less than 10 years, it will cost $285 per month to purchase Medicare Part A. The final thing I want to mention is that this amount is in addition to the $185 per month that it costs for Medicare Part B in 2025.
Okay, so that's really good. So I think a lot of the, parts of Medicare, it's like a chutes and ladders game. Some things are good. You got to watch out for that slide over there, stuff like that. Let me ask you this, when it comes to, like this whole 24-month waiting period, because, remember, it's, on our side of the fence with the disability lawyers, we're looking at, okay, what's the alleged onset date? What's the judge likely to move it to? Are they going to hit their 24 months? Do they have to wait after they're found disabled? If they don't have the money to pay for Medicare, are they going to get hit with some sort of penalty? How bad's the penalty going to be? How does that work when it comes to that 24-month waiting period? Because, sometimes that's a no biggie, no problem, especially right now because, a lot of people have to wait a long time to be found disabled. But we get people found disabled at initial filing, and then they're stuck. They got to wait. You know what I mean? They got to wait. And so how does that whole thing work?
That's right. It's very much a waiting game. Individuals with disabilities must undergo a lengthy process before receiving Medicare coverage. Congress has stipulated that people with disabilities must first receive Social Security Disability Insurance, SSDI, for 24 months before gaining Medicare eligibility. So here's the nuts and bolts. First, the Social Security Administration must make a determination of your SSDI approval. Second, individuals with disabilities must wait 5 months before receiving their SSDI benefits. Finally, after receiving your SSDI benefits, individuals must wait an additional 24 months before they receive their Medicare coverage. And non-consecutive is okay too. So if you've had 2 periods of disability, that is, let's say 2 12-month periods, that counts towards the 24 months, and you would be entitled to receive your red, white, and blue Medicare card. I should also mention one more thing here. There are exceptions to the waiting period if someone has ALS, that is Lou Gehrig's disease, or if they have end-stage renal disease. So that would short circuit the 24-month waiting period if that applies to you.
Now, this is a question I get a lot, and I've seen Medicare and I've seen basically the Social Security Administration do some interesting things, which is my polite way of saying it, when it comes to basically somebody getting treated while they're seeking disability benefits. Because, when they're seeking disability benefits and they're applying, they're usually poor because they're not working. That's like kind of the whole point of the program. And because they're poor, they don't have enough money to go ahead and, pay for medical treatment. So what I've seen, obviously Medicare, comp a lot of this stuff. I've seen the rule change, how many months before, is it the month that they start and stuff like. So from your perspective with this situation, how does that work with Medicare when they apply for disability benefits? How does that work if they change the alleged onset date once they've applied? How does it work for what month they're covered, so that if they're going to the hospital, they're going to the emergency room, or they got to get medication, or they got to go see the specialist, like how does that work? Will Medicare cover them, and for what period of time will they cover them throughout the disability application process?
Medicare won't cover the disability application waiting process. The best bet in this situation is to apply for Medicaid through your state Medicaid office. So just rewind this video to where Walter and I discussed that and hit play. Even if you think you earn too much income for a Medicaid buy-in program or spend-down program, it's still worth applying, because the worst thing that can happen is your application gets denied. But let me tell you, that certainly beats the prospect of going without health insurance or having to declare medical bankruptcy. So I certainly recommend applying for Medicaid if you don't earn enough to cover your health insurance costs, but you're in that waiting period before receiving your red, white, and blue Medicare card.
Okay, so that's interesting, because sometimes, and the government does this, like they'll like be like, hey, we've got these amazing options. All you got to do is be born and pay all these taxes for the rest of your life. So they get A, they get B, they get the auto enroll. I get that. What happens if they can't afford the B? You know what I mean? Because the B costs some money. You know what I mean? And some of these people, they don't get that much. Some of them are hybrid SSI, SSDI. Some of them are, just SSDI, but they're not getting that much. It's right around that $1,000 a month kind of gig. What are they? How do they opt? Can they opt out? When can they opt out? How does that work?
Yes, in this case, Social Security will automatically enroll SSDI recipients in both Medicare Part A and Part B before their 25th month of SSDI benefits. So you should receive your red, white, and blue card about 3 months before your 25th month of SSDI benefits, and it'll be dated to that 25th month of having received SSDI. Now, the Social Security Administration will print when your Part A and Part B coverage begins on your red, white, and blue card, and then the government will automatically deduct your monthly premium for Medicare from your Social Security check at the start of your 25th month of benefits, unless you send back your Medicare card. Now, the cost for Medicare Part B is $185 per month for most Americans. That's the Medicare Part B premium in 2025. $185 per month. So that's likely what the government will deduct from your SSDI check, unless you also qualify for Medicaid. If you also qualify for Medicaid, then you won't be charged that $185 per month for Medicare Part B. Now, finally, if your viewers don't want Medicare, then this is a big decision, and I would strongly